How much does diabetes cost you? And how much is it going to cost you? Let's talk about the real costs of diabetes. Not just the pills, not just the appointments, but the quiet, relentless toll it takes on you, on your body, on your mind, and the people that you love. First, it's the financial hit, obviously. You're told this is manageable, but the reality, lifelong medication, doctors, appointments, blood tests, and complications can cost you anywhere from 1 to 3 million rand over a lifetime. That's $80,000 to $150,000. What about the side effects of other complications? And that's just the direct costs. What about the time off work, the lost productivity, and the strain on your family's resources and energy? That's the indirect cost, and it adds up fast, believe me. But the financial side is just the tip. And yet, maybe you can afford this. Maybe you've even come to accept the missed opportunities, the missed holidays, the missed birthdays, and things that you've said no to because you didn't feel well or you weren't well enough. But what about the suffering, the unnecessary suffering, the preventable suffering? What really stings is the unnecessary pain, physical and emotional. The fear, the helplessness, the creeping limitations that quietly steal the richness from your life. Does this sound familiar? Do you think that rings true for you? Diabetes isn't just about blood sugar or glucose. It's about what happens when it's not undone. Here are some of the complications that diabetes brings, and they're more common than you think. Heart disease and stroke are 2 to 4 times higher risk when you have diabetes. These are the leading causes of death worldwide, and diabetes dramatically increases your chance. Single hospital visits for this can cost over 100,000 rand, $5,000. Kidney failure. Diabetes is the leading cause of dialysis in South Africa and very high worldwide. Treatment can cost more than 250,000 rand a year. That's $15,000 every year. Blindness. 1 in 3 diabetics develop something called diabetic retinopathy. It's irreversible and comes with a lifelong financial and emotional stress. Imagine losing your sight, or at least a part of it. Amputations are prevalent with diabetes. Yes, amputations, due to poor circulation and nerve damage. And this leads to massive quality of life reduction and long-term dependency on so many things. Dementia. Diabetes doubles your risk for this. Alzheimer's is known as type 3 diabetes. The emotional toll on you and your caregiver, as well as your loved ones with this, can be enormous. Depression. You're 2 times more likely to suffer from depression with diabetes, but it's rarely addressed in diabetic care. Fatty liver disease, high blood pressure, and even cancers have been shown to be increased with diabetes, with pancreatic cancer being one of the most aggressive cancers known. Medication dependence, insulin, statins, blood pressure meds, etc. can cost up to 3,000 rand a month, $200. So, projected lifetime cost, 1.5 to 3 million rand. In the United States, around $85,000 in medical costs per person, with over half of that spent on preventable complications. Years lost, 5 to 10 years on average are lost with diabetes. Quality of life lost is immeasurable. So that's not just years lost. That's weddings, grandkids, world trips, hikes, golf games, and lazy Sunday mornings. Walks on the beach, swims in the sea, adventures, dancing, skiing, boating, all gone. It's not just more years, it's better ones, better years, better life. Because with diabetes unchecked, life becomes smaller and less. With fewer adventures and less energy, less meaning, and less fulfillment in your life. I know this might sound like it's fear-mongering, but it's not. It's the reality. This is what people aren't telling you. And this is just a wake-up call so that you can make a different decision if you want. Because the good news is, it can be undone. You can undo this. This program exists, this mission exists because suffering should not be your story. So stay tuned. In the next video, we're going to talk about what happens in the body with diabetes and the real cause of diabetes and how to take back control. Keep watching.